me great pleasure to introduce Dr. Pettle. Dr. Pettle is a top anti-aging doctor, a bioidentical hormone specialist, and is considered to be the first Canadian gynecologist to introduce bioidentical hormones. Dr. Pettle, now for over 20 years, has practiced and taught the scientific basis and the safe use of bioidentical hormones in his integrative gynecology practice, teaching other medical doctors as well as naturopaths. Having also lectured at the Naturopathic College of Canada, he and his wife, Caro, use their skills of 40 years in an incredible partnership to serve patients at their private practice, the Ruth Pettle Wellness Center. The Ruth Pettle Wellness Center is named in memory of Dr. Pettle's late mother. Dr. Pettle uses the latest technology and techniques in hormone replacement therapy to tackle the problems associated with aging and menopause. Dr. Pettle has successfully used bioidentical hormones since 1994. Undeterred by medical doctors that remain skeptic, Dr. Pettle and his wife partner, Carol Pettle, who at one time was the head nurse of labor and delivery at Etobicoke General Hospital, now Sir William Osler Center, have now together been able to integrate both the allopathic model and the natural approach. So it gives me great pleasure to introduce Dr. Pettle.
Perimenopause is the 10 to 15 years that you go through where your hormones are not balanced, and then menopause by definition is 1 year without a period. And there's a great deal of controversy that has been around the world as of 2002, where the study should have been called The Good, Bad, and the Ugly, because the study was good because it stopped people from taking synthetics. It was bad and ugly because doctors have not thought about how to replace hormones in women who deserve them. And you live a longer life, you live a happier life. So knowledge is power. And once you have that power, Christine North wrote a book called Women's Bodies, Women's Wisdom, a terrific book that you should read. So these hormones that we're going to talk about, it maybe sound complicated, but it's not. It's really not. It's all about balance. It's all about homeostasis. And really, to know where we are today, it's good maybe to find out where we've been. So first slide. Okay. Can next slide, please? Okay. Tutankhamun. Well, why did I put that up? Well, that's how far back hormones have been thought about. He was a boy king, as you know, and in 1922, Howard Carter discovered his tomb, and he died at the age of 19. But one thing that was very interesting, his sarcophagus had breasts on the sarcophagus, and in medical terms, that's called gynecomastia. Men can have gynecomastia, men can get breast cancer. And he evidently had a sister that was precocious puberty at 6 years old. She had developed breasts. So there was a lot of people who thought that maybe they had something called aromatase excess. Aromatase is a way of taking your testosterone, metabolizing it into estrogen, men and women, and taking it out of the body. So if it excessively takes testosterone and metabolizes it too quickly into estrogen, it's like if your husband's taking testosterone, make sure that he's taking the aromatase inhibitor for a couple of days a week, because he will get breast buds and he could possibly have get breast cancer. So you have to have your blood tests done if male hormones are being taken. So I also put this up to show you that this all happened, it was 3,500 years BC. I think it was the 18th dynasty of Tutankhamun. But since these four individuals that I'm going to briefly suggest, nothing, not anything was known about hormones whatsoever. As far as I'm concerned, some people today still don't know about hormones. Aristotle, as bright as he was, he thought all sperm were male. Now, how that came to mind, I have no idea, but he gave it all to Bill. And then Serenus, he was the first gynecologist. He did figure out that sperm is likely male and female. They still didn't know what happened inside, but he at least figured that out. And Gowan agreed with him. Gowan was the MD doctor to Marcus Aurelius, so he was pretty bright guy. Next slide, please. So 1800 years go by before Dr. Thomas Addison. Anybody ever heard of Addison's disease? Addison's disease is a disease of the adrenals, where the adrenals are insufficient, and in his day it would be tuberculosis and things like that. But he was one of the first people to associate adrenal. Actually, he was studying anemia at the time, and he found out that if you had weak adrenals, then you had also Addison's disease. It became known as. By the way, you know that JFK had Addison's disease. Not many people knew that. He was given last rites 5 times before he died. Dr. Claude Bernard, in 1850, he did experiment. He was a physiologist. He did experiments where he's poured acid into the stomach of an animal, cut the blood supply off from the stomach to the pancreas, and when the acid went into the stomach, with the with the nerve supply cut off, the pancreas still secreted some kind of solution that he couldn't understand. How was he getting this message from the stomach to the pancreas? And of course, that was the beginning of the endocrine system. The endocrine system is a system of cells that talk to each other from the hypothalamus, thyroid, adrenals, ovaries, via the bloodstream. Okay, so endocrine. And once again, what you're going to hear from me is that any hormone you take, the body must believe you made it. And that's the big mistake they made in the studies, is that they were swallowing estrogen, and they had all kinds of side effects because first pass through the liver has several bad side effects. Michael Foster, he was the one that came up with the word called homeostasis. You know what that is? Homeostasis is like yin and yang, you know. For example, estrogen would be yang, progesterone would be yin, cortisol would be yang, DHEA, yin. Remember I said in the beginning, we have cortisol to the last beat of our heart, but your DHEA goes down by 1 point every 10 years. So if I have a 35-year-old woman do a DHEA on it, and her level is the level of a 75-year-old, then she's had a lot of stress. No matter what the blood test shows that day, it took a lifetime to get that DHEA down to that point. And DHEA is the defender. So DHEA hormone is exceedingly important in hormone replacement. But here again, if you go down to the States, matter of fact, the way I discovered the DHEA itself was one of my Monday afternoon offices. I had 3 patients all come in menopause bleeding. And I asked each one, did you take anything that I'm not aware of? And they all 3 said, yeah, we went down to the States, we heard DHEA is good for you, and we bought pills of DHEA. Well, all 3 of them had estrogen levels over 1,000 in menopause because DHEA was going to the liver. The liver doesn't make hormones, and DHEA was being made into estrone, the worst estrogen of all. So they were bleeding. I'm going to show you something. I'm sorry for my back there. So, hormones. I'll start from cholesterol. So an anorexic girl won't have a period, right? And that's 27 carbons. So if you just chop off carbons, it's like putting a marble down on the top and having it go all the way down to estrogen. The 27 carbons will become, well, pregnenolone, but then the biggie is progesterone. Now here's the thing. Why didn't people have a problem with menopause? Well, no one lived to menopause. You know, they lived to 40 years of age, so it was never a problem. Now it's a big problem. So progesterone is a great protector, I call, and it has the ability to make cortisol over here. And over here, DHEA. So DHEA is a hormone that is necessary to handle stress. It's a protector. And as we get older, people get cancer not because of hormones. It's multifactorial. Stress, environment, everything. The breakdown of your cells has to do with the loss of defense. So that's why young people. Doctors have written books saying men can't take testosterone at the end of their life. They can't take estrogen, and women can't take estrogen because they're going to get cancer. They don't get cancer because of hormones. Hormones, at their height, people don't get cancer. But when they get older and other factors come in, they can get cancer. Okay? DHEA, this is 21 carbons. This is 20 carbons. And this makes testosterone. By the way, women have progesterone. When you ovulate, we look a lot better than we used to do. Testosterone comes right after you ovulate. Okay? So progesterone makes DHEA, testosterone. This is now C19. And this gets down to estrogen. But estrogen is not one thing. You'll know more about your hormones with your doctor when I'm finished. Because estrogen isn't one hormone. It's 3 different hormones. It's estriol, which is a beautiful hormone of pregnancy. And we now know the more pregnancies you have, less likely you're having breast cancer. Okay? Androstenedione is over here. Here's so this is estradiol. This is estrone, E1, E2. But the best of the whole group is E3, and that's estriol. So there was a man called Henry Lemon. And if you're around perimenopause and you have a family history of breast cancer, like my mother passed from, Ashkenazi gene, not from hormones. But if you have a family history of hormones of breast cancer, you want to know what your EQ is. Probably as important as your IQ, because EQ stands for how safe are you? So you take the E3 and divide it by E1 and E2. So you take the heavy hitters, strong ones, divide it into E3, and if the number is greater than 1, you're unlikely to get breast cancer. So when I have patients who have family history of breast cancer, problem is you can't measure E3. Well, you can if you're pregnant. But if you're not pregnant, the only way to measure E3 is collect urine 24 hours. So that's called a Dutch test. Okay. Next slide, please. Oh, no, I think I missed 1939 Perman. Okay, let's go to the next slide then. You know what okay. You know what Perman stands for? Pregnant mare's urine. Yeah. I love a slide with a horse standing beside a doctor with a big syringe, and the horse saying, "There's no way I'm taking that human estrogen." And I had the doctor once tell a patient, "What could be more natural than urine?" I think you're running 6 furlongs at Woodbine. Yeah, but not. So Perman, what's the story behind Perman? In 1939, and what I'm going to tell you is that all this is surreptitiously. You know, the teacher will appear when the student is ready. So I graduated in 1969 as a doctor. I remember my father gave me a jacket saying Med 69. I said, "Dad, that'll never come." So when you look at what happened in my life and with what happened in the life of hormones, you'll see that sometimes bad things happen to good people, but they turn out maybe to be the best thing in your life. And in 1994, which I'll come to in a minute. So in 1939, they made horses' urine, they collected horses' urine, and it was mostly estrone, mostly the worst kind of estrogen you could get. 90%, 60% of it was estrone, which is the worst one, E1, and I think 30% was ectoline estrogen. I think about 5% was estradiol. So you couldn't get anything worse as a potent estrogen. And in about 1960, a guy wrote a book called Young Forever. Now, if he wrote a book like that today, he would be stoned, because he said, you know, isn't it a shame that women lose their beauty and this and that nonsense? But in my thoughts, a woman gets more beautiful with time than a young. So, thank you. So if you think about it, in when I was graduating, it was a given that people got Premarin. But when they started out giving Premarin with a woman with a uterus, what happened? Well, yang, the lining got thicker, and they all came back with cancer. uterine cancer. So they said, well, they can't do that. So they now had to give a progestin, like progesterone synthetic progestin, which is not a good word, but unfortunately, it's the umbrella of all the terms that go in progesterone. Progestin was then given to the patient, and everybody was happy because they didn't get uterine cancer. But what they didn't realize until 2002, how many years did that take? Well, 40 years it took them to figure out. Of course, it was the most sold hormone, Premarin and Provera, $1 billion in sales, something like that in North America, because women were going into menopause, had hot flushes. Yes, you can use black cohosh, donquil, you can use unsweetened pomegranate juice, but it's not the real thing. Okay, so if you can get rid of a lot of the symptoms, but you're not really treating or preventing heart disease. So in 1995, when I went into medicine in OB-GYN, I was in 1994. So in 1974, I went to the Etobicoke General, and Carol and I delivered close to 8,000 babies. Now our babies are having babies. So in 1974, that was the year I went into Etobicoke. But in 1994, my son came to me and had a lump in his neck. And long story short, he had thyroid cancer with secondaries in his lung. And thank God that's the one cancer that radioactive iodine kills. And he had secondaries, and he's now great. He's a playwright. My oldest son is an actor. It's all in the family. So Adam got sick in March of 1994. Now in 1995, real progesterone was metabolized by French scientists. It was the first time they now had a real progesterone. You could swallow progesterone, you could put it on your skin, but this was the first time you could actually do that. And that was the time I became interested. And I started to read books that I'd never read in medical school, because if you think about it, a doctor, nurse, teacher, how much time do you really have to study? Once you get out of medical school, you say, thank God I don't have to study anymore. But that's wrong. Education just beginning. One of my quotes, becoming a doctor takes education, becoming a healer takes time.
Oh,
So in 1995, you'd say, well, why wouldn't patients take natural progesterone and natural estrogen? We'll get to. Here's the answer. The government would only pay for Premarin and Provera. They wouldn't pay for progesterone or natural estrogen. So in 2002, a huge study was done. It was called the Women's Health Initiative. 16,608 patients across the United States of 40 centers were given Premarin and Provera, or Premarin by itself if they didn't have a uterus, and a placebo. So it's called a double-blind placebo study, because the doctor and patient doesn't know what they're taking. It's supposed to be I think a 7.5 or 9 year study. And in 5 years, they had to stop the study because they found out that the global index, which means how many complications, if this woman was getting the hormone and you were getting the placebo, this woman had more complications than you did. So it was now being dangerous to give the Premarin and Provera. So it was like the drug company kicked themselves in the shin. But they should have known that long before that time. They should have known that swallowing estrogen is not a good thing. Even though you get birth control pill, yes, I know people are young, but swallowing estrogen has what's called first pass effect through the liver. So what happens if anybody swallows estrogen? Well, the first thing that happens is they get increased clotting, increased coagulability. So if someone has a pulmonary embolus, someone has a clot, they can't take oral estrogen. So patients come to me with previous history of pulmonary embolus, and I give them estrogen, but not orally, okay, not through the liver. Second thing that happens is they elevate their triglycerides. So obviously cholesterol is an issue. The third thing that happens is they increase sex hormone binding globulin, which lowers the sex drive. Now, in some kids, birth control pill is used to grab onto testosterone so they have less acne and less hair loss. But once again, they're taking synthetic estrogen and synthetic progesterone, not any natural. But they're young, and it works for them. And the fourth thing that happens is that the ESR goes up. So, ESR is sedimentation rate. We use that as an inflammatory marker. If I do an ESR on you and it's 46, it's supposed to be 0 to 30. So if you put your blood in a tube and let the red blood cells drop to the bottom in 1 hour, if they're the normal size, they'll drop down under 30, like maybe 2, 3, 5 will be their number. But if someone's got rheumatoid arthritis and they've got pain or infection, their ESR will be elevated above 30. Okay, it's also a way of following someone's treatment for pain and for inflammation. But also, that's what happens if you have a patient swallow estrogen. Okay, so in 1994, when I went back to work, I was the chief of OBS and gynae. And I walked out of the office one day and I said to Carol, I'm going for a walk. And she said, well, are you coming back? I said, I don't know. I didn't come back for 6 months because I had kind of lost my way in that kind of fight and flight up the ladder, and really not really doing what I, in my heart, felt I should be doing. I used to put the lights off in the delivery room, put a baby in a warm bath, and have the daddy cut the cord. I used to call the boy, because, you think, why is a child screaming? You're hanging the child upside down, straightening out his or her back, light shining in the eyes. No wonder they're screaming. But we used to do that, and everybody looked at me twice, but it didn't bother me. I thought it was great with it. And I would have the baby kind of sucking its thumb and calm, and going onto the mother's chest and listening to the heart. Once again, telling the child there's no danger, just relax. So in 1994, when I went back to work, I had read all these books by Jonathan Wright, who was a genius in the United States, who had come up with an idea called triest. Okay, so triest is the exact ratio of the 3 estrogens transdermally. Okay, although there are people who give it oral. So I'm sorry, look my back. Triest is 10% of E1, which is estrone. That's the bad one of menopause. 10% E2, which is estradiol. That's the powerful one. And your blood has 80% estriol, which is a good one. Now, when I started doing this, I read a study by a guy named Pascal, and he showed me scientifically that should be 80. That when a woman takes estradiol, no matter what route you take it, 50% of it becomes immediately estrone. So by giving 10, 10, and 80, you're actually giving 15 of the estrone and 5 of estradiol. So I decided to make what's called biased, which is 80% estriol, E3, and 20% estradiol. So now I got 10% estrone, 10% estradiol. So less estrone, because estrone is the one that's more cancer permissive in menopause. Dr. Jonathan Wright has written many articles. He's a parallel kind of life to mine, but he gives lectures in the States, and they do courses in the States. But I gave you articles and I gave you handouts from him. He's very much ahead of his time. He once jokingly said that it would have been great. I think maybe it really happened in China for thousands and thousands of years ago. All the high school kids would pee into the same trough, and it would go downstream, and they let it dry out, and they put it into some herbs and give it to the king and queen, and perfectly balanced hormones. Have a good time. And maybe a way the grandchildren could pay back to grandparents. Of course, we have to screen for drugs. Not then, maybe, but maybe. Next slide, please. Okay. So, to summarize, in the 30s, 60s, I could understand giving synthetic, but not after the Women's Health Study. So the Women's Health Initiative Study is something you should know because your doctor's going to say to you when you reach menopause that you can't have hormones because of that study. When you tell the doctor that estrogen orally in a menopausal woman is first of all wrong. I don't care if the doctor is a bioidentical hormone doctor like myself and gives you Biest on a cream, or gives you estradiol in a patch or estragel in a cream. They're commercially made. We'll get into big pharma in a second, but understand one thing: in menopause, never swallow estrogen. Never swallow estrogen because you're going to have side effects, even if it's natural.
Sorry.
Okay. You know, I was going to take him home. And here's the other thing. 6 months after the study came out about the Women's Health Initiative, there was an article in the British Medical Journal saying, you know, don't throw the baby in the bathwater. You know how that term came around? Baby in the bathwater? Everybody in the house used the same bathwater, and baby was the last one to use it. You can imagine. So throwing the baby in the bathwater was a little bit. So if you think about hormone replacement, why did the study stop? Well, once you start swallowing Premarin, okay, and you give Provera with it, you insult the body, first of all, with giving a huge amount of estrogen. You insult the body by putting it through the liver. And then you insult the body further by Provera being 100 side effects of that drug alone. Headaches, depression. So, yes, if we didn't have a substitute for it, I can understand them using it. But not now. Now there is a substitute. Progesterone is available. 100 milligrams as an oral tablet, or transdermally 20 milligrams, because you need a smaller dose going through your skin than you need to go orally. However, oral progesterone, by the way, helps you sleep because the breakdown products of progesterone are sedative. So if I have someone in perimenopause and they can't sleep, I'll time the progesterone day 14 of their cycle. So day 1 is day 1, whenever it comes. And then for day 14, 1 tablet or 2 tablets, QHS, PRN, until the onset of the next period. Because beginning to miss periods in perimenopause is one of the problems, and insomnia is one of the biggest problems. Progesterone 100 milligram is a big dose for a little girl, so you're better off using sometimes transdermal progesterone. Talk about little young ladies. One thing you should know, if a young lady has her period later than everybody else in the class, she is going to be taller usually and more sensitive to estrogen, far more sensitive, because it's like, ouch, what is that? If she has it at a very early age, then she's less likely to be tall. She'll be shorter and a little heavier, but she'll have a higher ceiling. She'll be able to handle more estrogen. So why take hormones? Well, hot flushes was the big problem. I mean, I have a hot flush if I walk into my office and the room's full of people, and I get stressed and my cortisol goes up, and I'll have a hot flush. People don't know really why you have a hot flush, really, but it has to do with cortisol, and it has to do with a changing level of estrogen, not so much high or low, but it's kind of a changing transition level. So having perimenopause, and perimenopause hits people 30, 35, and it's 15 years before you go into menopause that you have an imbalance or estrogen dominance, because you lose almost like 90% of your progesterone, but you only lose a small portion of your estrogen. And sometimes your estrogen will be the only hormone you have. So there you got pure yang. And what does estrogen do? Well, estrogen has this ability to cause a lower thyroid. Okay, so why do people gain weight? Nothing to do with the sandwiches. So if you look at this, here's the thyroid, here's the ovary, here's the adrenal. If estrogen goes up, say cortisol goes up, because something's up, like fright, okay? And so the adrenal responds if the estrogen, so they kind of push each other's buttons. And if they both do that, producing thyroid binding globulin decreases the activity of thyroid. So the people come in my office and they're gaining weight, perimenopause, commonest thing, around the stomach. That's where cortisol puts down fat. Okay? And that holds on to the estrogen, and that's the beginning of all kinds of issues. Fatty liver, abdominal fat, stress. Okay? So stress produces cortisol. You're at the time in your life where You know, life happens while you're making other plans. So stress, cortisol. Up goes the estrogen. Ordinarily, estrogen would be brought back down with progesterone. But what if you haven't got progesterone? Then you've got pure stress, cortisol, DHEA drops, everything's out of whack. It's like an orchestra that one section's playing, the other one went to sleep. So progesterone, replacing progesterone, is the key at any time in your cycle. You can be 15, 16 years old, 18 years old, and have missing periods, heavy periods, estrogen dominance. Progesterone solves the problem. And it's easy, just natural progesterone cream on their skin. And it's just an easy fix. I have patients who have babies, they spent $30,000 in a fertility clinic, and I did a DHEA level and progesterone level, gave them progesterone day 14, gave them DHEA drops, and I had tapped on the shoulder exhibition. We said, see Dr. Pettle, those 2 kids, they wouldn't be here. So that's kind of nice to hear. So it's not difficult to do. You just have to ask nature to do what it's always done. So to get back progesterone, I don't think I've ever regretted giving someone progesterone in the 50 years I've been practicing. So it's not a bad thing. And how do you get it? Well, you can't eat yam and get progesterone. It's called the yam scam. They do actually have to have the yam converted into progesterone in the lab. So it is actually not yam that's doing it. It's actually, but yam looks like diacetyl, which I'll show you. So you can't eat yam and get progesterone, but progesterone can now be produced in transdermal. So thyroid, well, why do I bring up thyroid? Well, because thyroid, 1 in every 3 patients that I do blood tests on, 1 in every 3 have a positive antibody against the thyroid called Hashimoto gene. You got it from your mother or father, and it translates into the following, because you can have a gene that you're carrying, very high in Italian, ladies, because the gene means that gluten, dairy, and nightshades, red wine, potatoes, tomatoes, hot peppers, I'm probably describing the entire stuff. Red wine, so we gotta change to white wine, are all things that do this. When you have it hit your stomach, your brain says, ouch, what the hell was that? It hurts. Matter of fact, in the 1800s, they used to think that tomatoes were cancerous. But the reason I do the antibody is because it gives me a background, especially if someone tells me you've got a family history of hypothyroid. But doctors are very kind of stingy when it comes to giving thyroid. And thyroid, normal could be 0.5, the TSH, by the way, thyroid stimulating hormone comes from the brain, okay? So the brain stimulates the thyroid, T3 goes back. Remember I said T3 goes back, not T4, synthetics T4. So 0.5 to 5 is the range of TSH. So if you've got a range of 4.96, you got the worst mark in class. Because your TSH is a sine curve, right? And you're at the end. So if that patient's gaining weight, dry skin, losing hair, hello, their thyroid's not working. And why is the thyroid not working? Because stress is one of the things that started it, and estrogen makes it worse. So I do antibodies in everybody. And it's very helpful because it gives me a way to treat the patient's weight gain. Women come in perimenopause, most common symptom, insomnia, anxiety, irritability, depression, and changes in their menstruation, heavy menstruation. The next slide, please. So, tri-est. Remember what that is? And bi-est. And remember what that is. Okay, next one. Next slide. Okay. So, Premarin. Oh, by the way, the arm of Premarin and Provera was stopped first. The arm that Premarin with no Provera, women that had a hysterectomy, they continued to study because they didn't have the high complication rate that progestin, Provera, now gave to every woman. And I'll show you what those complications were. Myocardial infarction. So if there was a breast cancer, if there was an instance of 40 women out of 1,000 getting breast cancer, if they took synthetic oral hormones, there was 50 out of 1,000. So that's an increase by 20%, 25%. So it's not it's 10 people, obviously, but it's still a significant number. So oral estrogen is wrong. Media misinterpreted. So the study came out and they said we had to stop the study because of breast cancer being increased, pulmonary embolism being increased, myocardial infarction, clotting. What's the other one? The good positive side was less bowel cancer and better bones because oral estrogen did that. So the fallout, every doctor said, "Oh, I can't give hormones." I had a talk with a guy 2 weeks ago. Great guy, Nobel Prize. Didn't get it, but it was no. And he said to me, "I don't think women should get hormones." I said, "You're not a woman. That's number one." And I said, "Secondly, tell me why not." He said, "Well, we lived a life without hormones." I said, "Yeah, you lived your life till 45, 50. What do you live your life till 82? What about the next 30 years of your life?" Intercourse, vaginal dryness, dyspareunia, painful urination, frequent urination. I can go on and on and on. You want to treat them all? Give them vaginal estriol. They are now giving vaginal estriol to women with cancer, with breast cancer. Why? I had a young lady in Vancouver who wanted to come home to her daughter, to her mother. She was in late stage breast cancer, secondary to her bones. And I gave her estriol vaginally, and the lesion in her bones got smaller. I gave her estrogen, and they got smaller because you're now not letting her receptors get hit by the potent estrogens. There's competition. So if you got 3 different estrogens competing, now you flooded the receptors with estriol, she could come home for a short time. Next slide. Next slide says lock and key. Ever had a key and put it into a door, the wrong key? It's not going to work. You can keep doing it. You don't need to break the key or leave the key in there. But that's what doctors were trying to do. Synthetic adjusting doesn't fit the lock. The key and lock don't fit. So the receptors have to be very specifically. And for example, I said to you E3 is very safe. Estrogen hits different receptors. Here's a cell in the middle of the nucleus. And E3 goes into the nucleus and has an inhibitory effect. It's almost why baby boys don't turn out to be baby girls, because they're flooded with estriol. I never even thought about that in medical school. And E2, estradiol, the most potent one, it hits both the cell membrane and the nucleus. And the final one is estrone. It hits only the cell membrane. So lock and key, got to have the right information. Okay? Sorry. John Lee was a doctor in the United States. He wrote 2 very good books. What your doctor may tell you about perimenopause, what your doctor may not tell you about menopause. And he was ridiculed by a lot of people because he kind of felt too much. They said, "Well, you got a hammer and everything looks like a nail." Well, you know what? I'd like to still have my hammer for progesterone rather than anything else. A study in 1995 was very interesting. Chang had women who were going to have breast surgery, and they allowed themselves to have, it's called in vivo, cream put on their breast. So they had 1 milligram of estradiol put on the breast, and then 2 weeks later, they looked at the cells, and they had 200 times the mitotic activity than before. They then put the estrogen on, and then they put progesterone over top of it, 25 milligrams. Now they had half of the mitotic activity, so instead of 200 times, they had 100 times. But here's the fascinating part. The women who had progesterone alone put on the breast had less mitotic activity than placebo. Oh. So maybe nature has progesterone as a protector from breast cancer. And now you're told in textbooks you can't give progesterone. And that's the part that I'm now trying to fight. It's very difficult to fight because there's not that many people who have done that many studies to say maybe a breast cancer that comes back positive for estrogen, positive for progesterone, maybe the breast is trying to build a receptor to protect itself from estrogen, rather than saying progesterone causes breast cancer. They did a study on women who had, an operation for mastectomy or partial mastectomy, you realize, you probably, no doctor will, that any of you go to will know this. If the woman goes and has her mastectomy in the first 2 weeks of her cycle, she has less chance of survival than if she has the surgery in the second half of her cycle. Pretty amazing. Next slide. Oh, yeah, this is. They did a nurses study. They did a nurses study, a retrospective nurses study in California, and they took blood samples of everybody who had delivered over a 20-year period, and went back and looked at all the estriol levels. Estriol is a hormone that you can measure in a woman who's about to have a baby at term. As a matter of fact, that's how my wife, I was measuring hormones and stuff like that. She walked in the door and I was teaching these threes. This is I couldn't do the lecture anymore. But estriol is a hormone that's very high if the baby's healthy. Now, if the baby's getting unhealthy, the estriol starts to drop. So they looked in retrospective studies in a group from California, these nurses, and they found it was the last percentage you saw. I think it was something like 68% of the women who were in the 68% of the women did not get breast cancer, but the women that got breast cancer, all their estriols were lower than the other groups. So estriol protects you from breast cancer. Okay? And this is something that doctors, that's why I'm going back and teaching now, because my father once said, plant a seed where a tree will go, sit under the shade. So this is the way I can reach people, that I'll never meet. So I think I said that, didn't I? Yeah. Okay. Okay. Next one. Yeah. Oh, the placenta. If you are having a person who loses pregnancies, in the first 3 months of your pregnancy, progesterone, preparing for pregnancy, is the hormone that keeps the baby in there and the uterus does not contract. So if a woman's spotting or has ever lost a pregnancy, give her vaginal progesterone. A high dose of vaginal progesterone, the uterus will not contract. Because if you have a first trimester miscarriage, most likely half of the time it can be just a genetic problem, and the other half time progesterone deficiency. Nobody should lose any pregnancy with progesterone deficiency. So if you lose one, I shouldn't say damn sure, but make sure that doctors give you progesterone, because at 12 weeks the placenta will take over from the corpus luteum. So the corpus luteum that made the progesterone in the first place holds on to the pregnancy until the placenta takes over. Next one. So estriol, natural occurring hormone. That's the first estrogen they found, by the way, in 1939 was estriol, because they found it from the placenta. And the EQ I told you about, greater than 1, very unlikely you'll get breast cancer. Hot flushes, depression, heart palpitations, and by the way, thyroid can give you palpitations underactive or overactive. Okay, hair loss, the same thing. So hair loss, dry skin, palpitations. Thyroid connects up to a lot of different organs. That estrogen is looking for 300 receptors in your body. So that's what happens if you lose estrogen. There's 300 receptors that don't get very much. But progesterone, by the way, you can give progesterone to somebody and 1/3 of them will stop having flushes. So you can actually treat them without estrogen. Next one, please. Dehydroepiandrosterone. Why is that important? Remember I told this story about that Monday? I phoned down from the pharmacist and I said, Susanna, I've got patients I want to give DHEA to. How am I going to give it to them and have the body think that they made it? He said, well, you can make drops and put it under the tongue. And so we made DHEA drops, 10 milligrams per ml, which means they got about 2.5 milligrams under their tongue. And you take it twice, first in the morning when you get up, because when you wake up, cortisol wakes you up, DHEA has to bring it down. And then 8 hours later, which a lot of people forget. But here's the fascinating thing about DHEA. You see, if you have a woman, and in Life Labs, if you do a DHEA on a 40-year-old woman, and it comes back 2.5, I can tell you that's a 75-year-old woman. 3.5, 65-year-old. 4.5, 55-year-old. So when we're young, like all of you in the room, when you're young, you have very high levels. Guys have higher levels, but some women who are called alpha females, can convert female testosterone into male testosterone. It's a good thing, sometimes not a good thing. It's athletic, sometimes acne, hair loss, but it's a long lifeline. Because what's happening is if you have an ovary that's not making progesterone, the adrenals try and make up for it. Remember that flow chart? So if you haven't got progesterone, the adrenals start making DHEA, and what does DHEA make? Testosterone. Okay, so in a female, testosterone is 1/10 the potency of a male testosterone. But if you have 5-alpha reductase, that's the enzyme that makes you convert female testosterone. So you have to be careful with testosterone. When I give testosterone to patients, if you give 2.5 milligrams, it can go on the skin. You give a smaller dose, transmucosa in the vagina, that is going to be more effective because you have less side effects. So the lower the dose, the better. And sometimes by putting a hormone into receptors, less is more. Because if you put too much in, it gets filled up and it's like cement. The receptors can't pick up anything. But this hormone is part of, I guess anything, really, part of hormone replacement therapy in everybody. Because this is a longevity hormone. So this book was written by Abraham Morgan Toller, and he was from Harvard. You always, in a lecture, you always want to mention Harvard because it makes the guy who's talking sound intelligent. But he wrote a book that put urologists on their head because he said, you can take testosterone for life. Your heart's a muscle, your bones need testosterone. Whereas most doctors who treat men at the age, my age and younger, are very reluctant to give testosterone because they're worried about prostate, okay, and they're worried about the aromatization to estrogen. So males can block testosterone becoming estrogen by taking Arimidex. Half a tablet is what women take for breast cancer treatment. A man would take 1/2 tablet twice a week, and that would keep this ratio of estrogen to testosterone. Okay. Next slide. Testosterone makes strong bones. Progesterone makes strong. Progesterone, by the way, prevents osteoporosis because estrogen works on osteoclast, but progesterone works on osteoblast, which make bone. So progesterone has a place to play as testosterone does in bone density. By the way, I should have said at the beginning, when you write your questions down, I'll take the questions and read them, and then we'll give a break, and then I can answer your questions, okay? When we get to the end, rather than during. So, hysterectomy. So, a lot of doctors say, oh, you had a hysterectomy, you don't need any progesterone. That's nonsense, because you're giving someone estrogen, yang, and you're not giving them any progesterone, which is wrong. So, that's just a heads up. Next one. Progesterone's effect orally, I told you to sleep. Anxiety. Young kids come, PMS, PMS has, I think I wrote an article about it. There's 4 kinds: water retention, depression, anxiety. By the way, you know why you eat potato chips when you're anxious? Remember, one of the hormones you're making in the adrenals is aldosterone. So when you're stressed, the first hormone you lose from the kidney is aldosterone, the hormone that holds on to water. So how are you going to hold on to water? The body has to have salt. So if you start eating chips, you have anxiety. But, I have several children. Lowers blood sugar. Follicular and luteal phases. If I have a young girl trying to get pregnant, well, you're not going to do a blood test in the first 2 weeks because the level is going to be 0 to 5 no matter what. You have to do the blood test after day 14, day 18 to 22 to see whether or not they're ovulating from 5 to 20. And if they're not ovulating, that's where progesterone comes in. And I guarantee you DHEA will help. You do have to stop the DHEA once they become pregnant because it does make male hormone in the baby. We all start off as male and female. Do you know that? And it's only the presence of testosterone in the embryo that actually makes that part dissolve. So even though they thought there was only male sperm. And do you know one other thing which I found fascinating? When an egg, there's 2 membranes. And you know that 9 sperm get inside the outer membrane, but only one gets in. Did you ever wonder what that meeting was about? Because all of us were chosen, and I'd like to think it was the mother that chose maybe. That's I don't know. How is it possible? Because there's no other sperm gets in it, and nine, and only one of them gets in. And how is that one selected? You know, we're sitting here with 1 in 15 trillion possibilities of what we could be. So if you ever think you're not special, think again. Cholesterol I talked about a bit. I kind of, oh here, you see the bottom one? Remember I said Provera? Provera, synthetic progesterone, has a half-life, that means half of it's gone, of 22 hours. That means you never get rid of it. Okay? Whereas natural progesterone's half-life is something like 12 hours. So that's why progesterone's bad for you. Okay? You cannot take something that the body can't get rid of. Next slide, next slide. Around menopause time, I think I mentioned it. You lose 40 to 50% of your estrogen, but you lose 96% of your progesterone. And what does progesterone do? As we said, it's a vital hormone to keep a baby in there. It's a diuretic, by the way, which actually helps you lose water naturally. And it helps the thyroid. Remember I showed you the triangle where estrogen inhibits the thyroid? Well, progesterone is the opposite. So it restores sex drive as well. Next slide. Progestin, the umbrella used for both progesterone, and that's got doctors very confused because the compendium makes Provera and progesterone look like the same thing, but it's not. They're under the same umbrella. Next slide. Now, what happened with the pharmaceutical companies? If I told you that women's health study, which was over $1 billion, how many articles were written to try and defend and to reject and to say it's not right? There must have been thousands of articles because people scrambling around trying to get people to get back on it. Yes, there were people who were on it, were a little bit older than average, and most of them early in it, and they were perhaps not as healthy. Some of them were smokers. But most women who started HRT, even when I was in practice with Prevnar and Provera, 50% of them would stop in 1 year's time. He said, Dr. Pettle, my breasts are killing me. I'm bleeding. I gained 30 pounds. He said, well, you're taking horses urine and progesterone. So it made sense that we were kind of not just, we weren't thinking that the woman's body was not getting what the woman's body deserves. And we didn't have maybe the tools of it, but we do now. We do now. So there's no reason in the world that you should take synthetic. Media, alternative medicine. So bioidentical hormones, doctors used to laugh. I gave lectures 10, 15, 20 years ago at dinners, and I would see in the back people going chuckle like this, you know, older guys like me. But they were chuckling. I mean, they came from the state, but they were still chuckling that I was talking about bioidentical hormones. They will go like this, bioidentical hormones, like the quotations. But that's okay. I mean, it's really not okay if you can't change your mind. You know, you got to take a leap of faith somehow. As a doctor, as a nurse, as a teacher, you have to get outside the lines of what you're taught, or else how's anything ever going to improve? You know. So next slide. Well, this talk is not really about lifestyle dietary changes, but of course, to go along with all this, if a woman walks in my office with her purse open and there's 2 packs of cigarettes in her purse, I'm not going to start talking about bioidentical hormones because they're not going to help her. Okay, next slide. So, well, we can talk about that in a general sense, but as I said to you, if you have hot flushes and you don't go to a doctor, black cohosh, Quay, pomegranate juice is very good. Vitamin D, omega-3 fatty acids. Magnesium is great for helping you sleep at night. Magnesium by glycinate, if you go to bed at night you can't sleep. GABA is great. 5-HTP, which is a precursor to tryptophan. Next one. So, as doctors, a woman will come into the office and say, Doctor, I'm having terrible flush. I haven't had a period for a year. I can't have make love to my husband, it hurts. What am I going to do? So if the doctor is educated, he might give you some ways to treat it naturally. But will he get into hormones? Maybe not. And if you know what you know now, you will have an understanding that maybe you have to find somebody, nurse practitioner, naturopathic doctor, I'm going to train medical doctors who do know how to treat with transdermal progesterone and bias. And next slide. So I usually finish with a passage that, you know, I love, and it's comes from a book called Conversation with God by Neil Donald Walsh. I don't know if you ever read that book. It's a beautiful book. So I'd like to read it as my final thing. And this has nothing to do with being Catholic, being Jewish, which is it's just wonderful, I think, anyway. Use every moment of your life to think the highest thought, say the highest word, do the highest deed. Bring peace to the earth by bringing peace to all those whose lives you are fortunate enough to touch. Be peace. Feel and express in every moment your divine connection to the all and with every person, place, and thing. Embrace every circumstance, own every fault, share every joy, contemplate every mystery, walk in every man and woman's shoes. Forgive every offense, including your own. Heal every heart, honor every person's truth, adore every person's God, and protect every person's rights. Preserve every person's holiness, promote every person's interests, and provide every person's needs. Be a living, breathing example of the highest that resides within you. Speak humbly of yourself, lest someone mistaking your highest truth for boast. Speak softly, lest someone think that you are merely calling for attention. Speak gently, that all might know of love. And speak openly, lest someone think you are trying to hide something. Speak candidly, so you cannot be mistaken. Speak often, so that your word can truly go forth. And speak respectfully, that no one be dishonored. And speak lovingly, that every syllable may heal. Make your life a gift. And always remember, I have sent you nothing but angels, and my angels carol. Thank you. Here's a question here. Menopause and gained 30 pounds. Scared of progesterone because I've read articles in health. The articles you're reading are about synthetic. Even on websites, and you can't go by Google because Google is written by Google. And that big pharma, they have only one. You can't sell something that is nature's own hormone. You can't patent progesterone, but you can patent something that looks like progesterone to make money. So that's why big pharma has no reason to do a lot of work in natural hormone. Fine, they make now progesterone half of which can be from. You can get natural progesterone. Natural estradiol, you can get estradiol, which is natural. It would be 100% of estradiol for one of the ladies that I'm taking hysterectomy, I'm taking gel estradiol. So she's taking 100% estradiol, which is fine as long as you're taking a couple hundred milligrams of natural progesterone. Okay. She takes synthetic, she gets later on, if her estrogen level gets too high, she may get breast discomfort or she may bleed. There's no need to bleed when you're in hormones. There's no need to bleed. Suzanne Summers, may she rest in peace, came here a long time ago and you gave a lecture and mentioned my name. But she followed what was called the Wiley Protocol. And that quality protocol is to convince women to agree to have a period in menopause. God knows why. Me, it would be nice not to have one. So she had an escalating level of estrogen and an escalating level just from to mimic a woman's own cycle. See, there you now get into a topic of should a 55-year-old, 65-year-old woman have that much estrogen? The answer is probably no, because sure, if you're in Hollywood, you're big busted, you're out there, and that's what you have to be, then maybe. But it has very little to do with what's safe. Suzanne Summers passed because she, I think, genetically may have had a predisposition as her mother did. I don't know. But she was talking into the Wiley protocol. Now, I've had 9 people in 25 years start the Wiley protocol. One of them now is left on. Only because I can't find her to get it. But, so the answer to your question is don't go by what you read, go by what you feel. Okay? You're not going to find in Google that they're going to say this bioidentical hormones are better than synthetic because who's writing them are drug companies. And they're not making any money. The only people who make any money, I should have mentioned this, the pharmacy that paid me a small amount of money to come here is a pharmacy that does compounding. Okay, so, and if they don't do compounding, then they may send it out to do compounding. But there's now, in regards to this, kind of a relative of mine, very brilliant guy. He was the pharmacist who owned York House Pharmacy, and his brother married my mother's sister a long time ago. My mother died of breast cancer, her sister died of breast cancer, their mother died of breast cancer. And so the BRCA gene is obviously a separate issue in regards to ovaries and breasts. But to be educated and go into an office and say to a doctor, do you mind if I have natural progesterone? Rather than I can give progesterone. And if you want to take transdermal estrogen, you never take all estrogen. Someone came to my office 6 weeks ago on the birth control pill at me 54. Now she's going to have a lot. She's going to go an impulse. But the doctor couldn't give her anything else because that was very much. Now, birth control pill, I was supposed to be one of the experts in the world on birth control pills. But when you're young, you get rid of a lot. As you get a little older, the cells don't heal as well. And you have oxidative rash. Well, the other thing you also need to take was CoQ10. 100 milligrams after coenzyme Q10. Take water soluble vitamins in the morning, B and C, and fat soluble things like vitamin E, CoQ10 after supper. 100 milligrams is fine. I make a compounded one, but you don't get intervention for early menopause. Intervention. There is no intervention. You cannot stop someone. You don't need eggs you're born with. A woman is born with 400,000 eggs. 400,000 eggs. And only very few make it to maturity. That's where I came up with the term. You think 400,000 eggs to start with. A man's ejaculation rate at 25 million per ejaculation. You can start doing the math. It's incredible that we insisted on. I mean, that we is very interesting. Why, how come one of those lines that I would like to think that maybe the mother was more important than did the choosing guys. But it's interesting. Thermography versus mammography. Thank you for asking me. Will, Will's dad is Dr. Alex Monsterboy is a friend of mine. And Alex was a homeopath I met 25 years ago, and I said to him, Alex, learn about thermography. And after cutting my binge, he said, sounds sexy, you know, there's a mammography. What is thermography? Cancer is located by mammography because you can see a white mass, okay? But long before you ever get a mass, there is trouble, and heat begins to heat up the cells. So the cells go from 1, 2, 3, 4 in heat. So if I feel a lump at 3 o'clock on the left breast, send it to thermography, and last year it was a 2 and now it's a 3, suddenly I don't write a prescription for so much estrogen. I downgrade the estrogen because that is heating up. Now, not all cancers are hot. Some cancers are cold. The thermography is not painful. You stand with a woman and heat comes off the breast. And you can, it's used all over the world, but thermography is an intermittent way of increasing mammography to crush a woman's breast and radiate a woman's breast. The reason my son got thyroid cancer is because when he was premature, they didn't have any cover-up sled. He had lung x-rays over and over again, and that's what gave him thyroid cancer. So now you see everybody wearing a neck cut, right? So you begin to learn. But breast cancer, I taught 200 naturopaths how to do a breast exam. I asked Bryce Taylor to come down from the audience, who's a riot. 250 women laughing as I examined his breast for breast exam. But it's actually an 8-part examination. You do it when you're menstruating. You go into the look in the mirror and you put your hands on your hips, and what you're looking for, cancer grabs onto the skin, it's like a claw and pulls in. So if you see an indentation, and then put your hands above your head, that indentation goes farther in, then that's abnormal. Okay, and that's sometimes the first sign of breast cancer. So women find breast cancer before she's in the shower. Try to examine yourself at your menstruation because your estrogen is the lowest at menstruation. That's the best time to do it. I have a picture somewhere in the handle that it may be there, how to do a breast exam on yourself. Thermography, I believe in, agree to. What is your opinion on the use of synthetic growth hormone? Good question. To grow taller. That's a very difficult question. Growth hormone in a woman in perimenopause, menopause, is suspect because it's something that you think you're anti-aging. DHA is much better, by the way, much easier. But I do give some stays on for growth hormone. I'm not a pediatric hormone physician, so if I think a child is not growing, I think you have to get an expert on pediatric hormones, and growth hormone is certainly available. I used to lie on lifting my head down and stretch my body out too, so I could be taller. It didn't help, but sometimes small things. So that I can't really give too much information on that. Is there something safer that could be taken? Changes, heavy bleeding, pain, fibroids, good question. So all of the medical conditions like fibroids, like endometriosis, where the person menstruates internally, the uterus is covered by peritoneum. Peritoneum is embryonic tissue. Embryonic tissue can be any tissue it wants to be. So when the period time comes, the stoma cavity acts like it's endometrial tissue and bleeds inside the pelvis. And so you get painful periods, painful intercourse, and maybe a reverted uterus if you have an ultrasound. 1 in 5 uteruses are tipped backwards. So if you have painful intercourse, maybe be on top. But if the uterus is tipped backwards because of endometriosis, then on examination you can feel endometriosis is very difficult to get rid of. But it's all about getting rid of estrogen. We are what we eat. A cow walks through that door, we are what we eat. And if you're going to have a steak with estrogen, you're going to have menstruation. The more you have in period, but fine. You have to have red meat. If you have to have red meat, it's especially, you have to know that it's full doesn't cheese. Doesn't have to be from a cow. So eat smaller animal, less estrogen. So the question really is, the benign condition, yes, you can treat endometriosis. Can you treat fibroids? Well, here's the thing about fibroids. If a woman goes into menopause and doesn't get any hormones, her fibroids will shrink by 1/3. If you give her hormones, it won't shrink. Okay. Well, the fibroids are like locations of everything. If the fibroid is outside the uterus, it's called subserosal. It's not going to cause bleeding. It can be hanging like a grapefruit. If it's in the muscle of the uterus, then it's intermyometrial. Not likely to give you a problem. In rare cases, I once had a patient with fibroid. She was 5 months pregnant, and the rest of her abdomen was all fibroid. And I had to operate on her while she was pregnant and cut the top, so otherwise the baby couldn't grow. But if a fibroid is submucosal inside the lining, yes, you're going to have a problem bleeding. And that's very difficult to treat. One surgical procedure you can do a submucosal myomectomy with a hysteroscope if they're small. The fibroids will not shrink in menopause. very rarely just a hysterectomy. Nowadays, in my day, hysterectomies were done far too often. And cesarean section is another whole other issue, but hysterectomies were done. Nowadays, they're very strict with hysterectomies. They can do laparoscopically with belly button incision, pull the, put it smack on the cervix, pull it down, burn down the side. They can do vaginal laparoscopic hysterectomy. You're home the next day. Our patients stayed for a week because you're inside the abdomen, just messed around with. And so they're pretty strict with laparoscopes. But you have to have a surgeon for endometriosis. You have to have someone who knows what they're doing. I once traveled, from Toronto to Oregon, 4,000 miles, because a patient of mine, she had a subtotal hysterectomy out of cervix that she wanted to remove, but she wanted assurance that she wouldn't have a bag colostomy if they got into the valve. So I went with fellow Dr. Begline, and I did with him a 4-hour surgery procedure through a laparoscope. And they did get it to the valve, but they sewed it up. But laparoscope, minimal invasive surgery is all available now. So hysterectomy, I'm not saying hysterectomy is an easy operation. I'm just saying hysterectomy is a pretty radical operation at all. But there's part of a woman that they tell me that something is missing, and it's I don't know if it's a soulful thing or whether it's just part of who you are as a woman. It can affect someone emotionally. Hormonally, the ovary should probably stay unless you have a family history of ovarian cancer. So if you're 48, 49, 50, the question is, do you take your ovaries? So one patient here asked me about ovarian cancer. She took the fertility treatments, and that increases slightly your chances of ovarian cancer because you're kind of breaking the surface of the ovary every time you treat. And some people recommend the birth control pill a couple of years before you go to menopause to make the outside surface and not act. One more here. Couple more minutes. Yes?
Dr. Pettle, just what we have just want to mention going back to the mammograms with Dr. Mostovoy.
Dr.
does-
Mostovoy? Yes.
Yeah,
You want his phone number?
I've gone to him.
Oh, yeah.
His-
Yeah, I can give you his phone number.
I just want to mention if anyone's interested, he does have a book out and it's called Breast Cancer is a Preventable Disease. So
So I can't hear you.
he has a book out. It's called Breast Cancer is a Preventable Disease from
Alex?
Dr. Mostovoy,
Alex, yeah.
if anyone's interested.
What are the causes of painful periods in late teenage years? Estrogen dominance, where you have cramping from estrogen, and so the uterus and ligaments cramp, and progesterone calms everything down. If they don't have enough progesterone, then it will be painful. Heavy periods, PMS is a whole different issue. PMS is basically too much estrogen. And if the young girl, as I said to you, is tall and thin and she had late onset of pregnancy, she's more sensitive to estrogen than a girl who had a period. The average menarche when I was in school was 13.5 for a teenager. I guess now it's probably 11, 12, right? It's growing. And that's because estrogen, the estrogen in the earth has now decreased the sperm count by 50%. Not one more question. I got two more here. Is there some specific test that can be taken to deal with heavy bleeding? Yes. Pain? Yes. Fibroid? Yes. Well, of course, you need an ultrasound. You should have an ultrasound at painful periods to see whether endometriosis is there. And estrogen is going to be more dominant than progesterone. Another way of knowing that in the PCOS, polycystic ovarian syndrome, the FSH, follicular stimulating hormone, is in a normal teenager is greater than LH. But in a PCOS patient who's having trouble making progesterone, their LH is greater than the FSH. It's switched. And that's the way of diagnosing a teenager who's not ovulating. And she's now having symptoms of irregular periods, painful periods. And one time, when you have an ultrasound, by the way, have it always in the first half of your cycle, because if you have an ultrasound in the second half of your cycle, you can have a functional ovarian cyst that's supposed to be there. And someone will say, well, that's abnormal. But if you do the ultrasound in the first half of the cycle, there can't be an ovulatory cyst there. So if there's something on the ovary, it means something. So the ultrasound should be done in the first part and blood test in the second half of the cycle. One more, can you address the fact that You can have a low estrogen, but still be estrogen dominant. Yes, of course. If the ratio between estrogen and progesterone is 20-1, that means if your estrogen is 200 and your progesterone is 10, that's the right ratio. But you can have an estrogen of 50 and a progesterone of 1. That's a 50-1 ratio. So you're going to have low estrogen, but still estrogen dominant. That's why you need progesterone. And the last question, what about that one?
Can I ask them? I
Sure.
didn't get to write it. So I was always one, my friends keep telling me to get an ablation done
Individual, but
because my doctor laughed at me when I said, can you just take out my uterus and the bleeding stops?
Yes.
She's like, no doctor will do that. And I don't have all this information that you're talking about and kind of all new for me. But what is an ablation? What is that?
individual ablation is like taking a lawnmower inside the uterus.
Oh, okay, sounds good. But that's.
It's a lot easier than a hysterectomy. If a hysteroscope looks inside of you know why the uterus is called hysterectomy? That's because men named it hysteria, going through. Nice, very nice. So hysterectomy, if you have individual thickening and you're bleeding, and you can't stop the bleeding, number one, you get all of the definitely you can get, it doesn't stop. Unless it's a fibroid sticking inside the uterus, then it will stop. But if you can't stop bleeding and you're anemic, then one of the treatments is to take a hysteroscope, look inside the uterus, and then kind of spin down each part up and down, like a long, and then hope it doesn't bleed. Any other questions? Not like that.
So, I had my son at 41, my first son.
Very nice.
You know, if I had known, sometimes ignorance is bliss. I don't think because I just thought, okay, you know what, I'm gonna get pregnant, you know, and if we don't, we'll adopt. But for me, it's the last 5 years that, and I do everything clean, glass, no plastic, clean products, you name it, I do it. But my breasts have become huge.
Yeah, what's happened is that you ovulated at a time when, I mean, to find out whether you can get pregnant, by the way, at that stage, you have to be under 10. Look, you're stimulating hormones over 10, you're unlikely to get pregnant because the brain is having too hard a time making. So when you ovulated, you made it, but now you're in perimenopause and now you're estrogen dominant, you need progesterone.
So for me, my last period, I'm 54.
I can't hear, sorry.
I'm 54. So
I still can't hear.
she's 54.
Oh,
I'm
you're
54.
54.
So, my last period was last year, February. So I'm officially menopause, like I've hit menopause. Because
What symptoms are you having besides breast tenderness? Because you still have estrogen.
so it's the weight gain for me. I know I have high stress, so that's what I have to,
You also have a young child.
yeah, and there was online learning, and so that really did it for me, I think. But,
For everybody.
you know what, I was getting, and I didn't know the night sweats, but I don't get the symptoms, other than the weight gain.
Yeah.
I sleep beautifully, what I think.
You still have a hormone test. You can still find out if you're DHEA as well.
So, I sleep, I don't get the night sweats, but I do, if I get worked up, then I feel like a bit of a flash. I don't get the hot flashes, I don't get any of that.
That's cortisol.
Yeah, so
You need something to compete.
So I'm thinking of the breast reduction. I'm gonna get to my question,
Yeah,
which is
you
that.
talk
I've been
about-
talking about it. The clinic, Mostovoy is against it. I don't know whether I should, I will be coming to see you, so I'm wondering if I should be first, obviously, hormone hormone.
testing. You should hormone testing. If once your hormones are tested, you're gonna find out if your thyroid's functioning.
Yes.
Whether you
Before any surgery.
High. You don't need to have surgery. If someone has surgery and it goes to a plastic surgeon, OHIP will cover it only if you can tell them mechanically that your back's killing it.
Is there a danger to it? That's what I'm getting.
Danger of having?
Breast reduction, especially at this age, maybe.
No, there's no. danger, I mean, surgery is still surgery, and someone can die of an anesthetic problem. But no, I think it's really, you don't, I wouldn't say that it's a height of surgery, but it's still surgery, and it's pretty traumatic. It's pretty traumatic. And if you have severe pain, yeah, but you should try things like evening primrose, which compete with estrogen. You should try something like omega-3 fatty acid. There's a lot of things you can try to compete with, called phytoestrogens, which compete with your strong estrogen. But I'd like to see a hormone. And progesterone protects your breast.
Is it good to take Broccol Protect right
Broc-
now?
what?
Broccol Protect?
Yes, Broccol Protect, it blocks estrogen's metabolism into the bad estrogen.
But are we kind of aiming to block or are we aiming to balance?
It blocks, it can't block it completely, but it decreases the likelihood of breast cancer. Estrogen is an interesting hormone, but when you swallow a piece of meat that has estrogen, it goes into your stomach, then goes to your liver. Your liver then puts it in a capsule, and then puts it down the bile duct to your bowel. So if you have bad bacteria in your bowel, that'll break the surface and release the estrogen, you'll have more estrogen. If you're constipated, the estrogen will be too long. Okay, so there's all kinds of way of decreasing your absorption of estrogen as it goes back in the bowel. And indole 3-carbinol too, that's what we're talking about.
And just one more thing, what are your thoughts on the carrot salad?
And you're, sorry.
What are your thoughts on the carrot salad? I know.
Carrot.
Carrot salad.
So
Well,
Dr. P,
cruciferous vegetables are the ones, like broccoli and broccoli.
so there's,
Ones that block estrogen metabolism.
Two quick ones.
Yeah.
You don't believe in the carnivore diet?
No, carnivore diet's okay, that's Atkins diet. Meat and vegetables, you can lose weight. Yeah.
Okay, and the difference between Z1 and Q10, so I took my mother and myself. You think one all, one Q10.
Same thing.
Same thing?
It is same thing. Country itself, which is, ubiquinol stuff. Okay?
So Dr. Pettle, we can contact you at this number for an appointment?
Yeah, ask for Lori, say you were here tonight. That one first. No, my oldest daughter.
But don't we have to do
No.
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 Where are your referrals?
This is the referral.
Actually, there's the referral back. If you want your flower, I brought.
Yes, thank you. Thanks for the flowers. Thank you.